What unfolds when the 28-year-old son of a hospital chief, a freshly licensed physician, forcibly ejects a 64-year-old Medicaid patient from the emergency room, declaring that Medicaid patients drain hospital resources and that people who can't afford real insurance don't deserve urgent care? This entitled young doctor is about to learn that certain acts of patient cruelty end medical careers instantly. Sometimes a single phone call to a state medical board results in license revocation. And sometimes open contempt for the poor forces hospital executives to resign within 60 seconds. But what makes this case truly devastating isn't only the abuse or the discrimination. It's what happened when Judge Frank Caprio placed live calls to the state medical board in CMS. Within 1 minute of hearing Dr. Marcus Chen openly describe systematic Medicaid discrimination at his father's hospital, the board revoked his license, CMS suspended federal funding, and his hospital chief father was compelled to resign. It's a Monday afternoon in Providence Municipal Court. Dr. Marcus Chen, 28 years old, a first-year resident at Providence Memorial Hospital, where his father, Dr. Robert Chen, serves as chief of medicine, faces assault charges stemming from an emergency room incident 4 days earlier. The victim is Dorothy Williams, 64, a retired school cafeteria worker surviving on Social Security and Medicaid. She arrived at the ER suffering severe chest pain. Dr. Marcus Chen, dismissive of her Medicaid status and convinced she was exaggerating, verbally berated her, denied treatment, and physically forced her out of the emergency department, causing her to fall and fracture her hip. Hours later, Dorothy sought care at another hospital, where doctors confirmed she had suffered a real heart attack. When hospital security officer James Park attempted to intervene, Marcus asserted his authority. "I'm Dr. Chen. My father runs this hospital. I decide who gets treated. This Medicaid patient is wasting ER resources meant for real patients." Security documented the incident, but Marcus's family connection complicated internal response. Now Dr. Marcus Chen enters Judge Frank Caprio's courtroom, and everything about him projects medical privilege and elite entitlement. He wears his white lab coat over tailored clothing, a luxury watch on his wrist, hair perfectly styled, carrying a leather medical bag embossed with his name. He walks with the confidence of someone who believes both his MD and his father's power place him beyond consequences. Seated behind him is his father, Dr. Robert Chen, the hospital's chief of medicine. Composed yet visibly tense, Judge Caprio watches carefully. Wearing a medical coat in court is not accidental, it's a declaration that medical authority should override civilian law. The bailiff calls the case, State of Rhode Island vs. Dr. Marcus Chen, MD charges, assault and battery, patient abuse, medical negligence. Judge Caprio studies the file, concern etched on his face. These are extremely serious allegations for a licensed physician. "Dr. Chen, how do you plead?" Marcus rises, straightening his white coat. "Not guilty, Your Honor. This case reflects a misunderstanding of emergency medicine triage and responsible resource management. My decisions were medically appropriate. The patient's later condition was unrelated to my assessment." His voice is clinical, detached, saturated with superiority. Judge Caprio narrows his gaze. "Dr. Chen, you're accused of physically removing a patient from the emergency room. Explain your medical judgment." Marcus speaks as if lecturing residents. "Emergency departments are overwhelmed nationwide. Physicians must prioritize based on acuity and probability of genuine pathology. Ms. Williams presented with nonspecific chest discomfort. She has a documented history of frequent ER utilization. She's on Medicaid, which statistically correlates with health anxiety and symptom exaggeration. My assessment was that she was seeking attention or medication. She did not warrant emergency resources and was advised to follow up with primary care." Judge Caprio interrupts. "By advised, you mean forcibly removed?" "I escorted her out," Marcus replies calmly. "She resisted. Limited physical contact was required. Emergency rooms cannot function if every anxious Medicaid patient is treated as a true emergency." If you're not subscribed, hit that button now, because what happens next proves no medical degree excuses cruelty. "Ms. Williams," Judge Caprio says gently, "please come forward." An elderly woman approaches slowly using a walker. 64 years old, dressed in worn, modest clothing, clearly someone living paycheck to paycheck. Each step causes visible pain in her left hip. She steadies herself before the stand. "Ms. Williams," Judge Caprio says, "tell the court what happened." Dorothy's voice is soft but steady, the voice of someone who worked honestly her entire life. "Your Honor, I'm 64 years old. I worked in the Providence High School cafeteria for 35 years. I live on Social Security now. Medicaid is my health insurance. 4 days ago, I woke up with crushing chest pain, heavy pressure spreading down my left arm. I was terrified. I thought I was having a heart attack. She pauses, catching her breath. I drove myself to Providence Memorial's emergency room. I told the nurse about my chest pain. She took my information, saw my Medicaid card, and had me wait. After 2 hours, this doctor, she gestures toward Marcus, called me back, not into a room, just into the hallway. He asked, "What's your complaint?" I told him about the pain. He said, "Chest pain? Really? How many times have you been here this year?" Dorothy swallows. I said twice. Once for pneumonia, once after a fall. He laughed and said, "Frequent flyer." Of course. I asked what that meant. He said, "People on Medicaid come to the ER for everything because it's free. You're wasting resources." Her voice trembles slightly. I told him I was scared. That the pain was real. He said, "Everyone says that. Your vitals are stable. This is anxiety, not a heart attack. Medicaid patients always think every symptom is an emergency." I begged to be examined. He said, "I'm not wasting an EKG or labs on you. We have real patients who need those resources, individuals with legitimate insurance who actively support the system." Then he seized my arm and dragged me toward the exit. I told him I wasn't leaving without being treated. He replied, "Yes, you are. We don't waste time on Medicaid freeloaders." He shoved me through the automatic doors. I hit the concrete outside, landing hard on my hip. I couldn't stand. A stranger passing by called 911. An ambulance took me to Rhode Island Hospital. They ran an EKG right away. I was having a heart attack. They performed emergency angioplasty. The cardiologist told me that if I had waited any longer, I might have died. This young man, almost killed me because I have Medicaid." Judge Caprio's expression tightens, fury barely restrained. "Ms. Williams, I am deeply sorry this happened to you. How are you doing now?" "My heart is improving, Your Honor, but my hip was injured in the fall. I can't work the part-time job I relied on. I'm surviving on even less income now." Marcus interrupts, his tone still clinical, his confidence unshaken. "Your Honor, Ms. Williams' account is emotionally charged but medically misleading. Her vital signs were stable at triage. EKG changes can emerge hours later. My assessment at the time was appropriate. A diagnosis made afterward does not establish negligence." Gasps ripple through the courtroom. Dr. Robert Chen, Marcus's father, looks crushed. Judge Caprio turns sharply to Marcus. "Dr. Chen, you've just heard a patient describe nearly dying after you denied care and physically expelled her. And your response is to justify your medical judgment." "Your Honor, I'm explaining proper resource management. Emergency medicine requires triage. Medicaid patients statistically overuse emergency departments. My father runs Providence Memorial. He's taught me that hospitals cannot remain solvent if we treat every Medicaid patient like a paying one. This isn't discrimination, it's financial reality." Dr. Robert Chen rises abruptly. "Marcus, stop it, Dad. The court needs to understand hospital economics. We can't operate at a loss by prioritizing Medicaid patients." "Marcus, sit down." But Marcus keeps speaking, addressing the courtroom as if lecturing residents. "Your Honor, Medicaid reimburses hospitals at roughly 80 cents per dollar compared to private insurance. We lose money on every Medicaid patient who receives extensive care. Emergency departments must prioritize revenue-positive patients, those with private insurance or Medicare. My father has explained this many times. Providence Memorial's survival depends on restricting resources spent on Medicaid populations. That's standard administration practice." Judge Caprio's voice turns cold. "Dr. Chen, you're describing institutional discrimination against Medicaid patients. You're stating that your father, the chief of medicine, instructed you to prioritize patients based on insurance coverage. It's not discrimination, Your Honor. It's triage based on payment source. Every hospital does this. Most just don't say it out loud. My father oversees a $200 million budget. He can't allow Medicaid patients to drain resources needed by profitable patients." Dr. Robert Chen buries his face in his hands, fully aware his son has just admitted to federal civil rights violations. Judge Caprio signals for the emergency room security footage from Providence Memorial. The screen shows the ER. Dorothy sits in the waiting area, visibly uncomfortable, clutching her chest. Marcus calls her over, not into an exam room, but into the hallway. A brief exchange. Marcus's posture is dismissive, impatient. Dorothy attempts to explain, clearly distressed. Marcus grabs her arm, pulling her toward the exit. She resists, trying to stay. Marcus forces her toward the automatic doors and shoves her through. Dorothy falls onto the pavement outside. Marcus turns and walks back into the ER without checking on her. Staff rush to assist Dorothy from inside the glass doors. When the footage ends, the courtroom is filled with stunned silence. Judge Caprio faces Marcus. Dr. Chen, that video shows you physically ejecting a heart attack patient from your emergency department. Marcus remains unfazed. Your Honor, the footage shows appropriate handling of a non-emergent Medicaid patient during a high-volume shift. Truly ill patients were waiting patients with legitimate insurance. I made a triage decision. You continue to reference insurance. Is that how you decide who merits care? Your Honor, it's one factor. I'll be candid. My father runs a hospital. He's taught me the realities. Medicaid patients are financial liabilities. They come to the ER for everything: minor illnesses, anxiety, drug seeking, attention. They consume resources that privately insured patients subsidize. If we treated every Medicaid patient as equally urgent, hospitals would collapse. So yes, insurance matters. Private insurance is prioritized. Medicaid is managed out when resources are strained. Judge Caprio reaches a decision that will end Dr. Marcus Chen's medical career and force his father from his position. Clerk, place immediate calls. Contact the Rhode Island State Medical Board. Also notify CMS, the Centers for Medicare and Medicaid Services, Civil Rights Division. Marcus's confidence finally fractures. Your Honor, that's completely unnecessary. This is just an assault case. Dr. Chen, you've openly described systematic discrimination at a federally funded hospital. This is far more than assault. These are federal civil rights violations. Dr. Robert Chen rises, shaken. Your Honor, my son is young. He doesn't understand the consequences of what he's saying. Chen, your son has stated that you taught him to discriminate against Medicaid patients. Sit down. Moments later, two voices fill the courtroom through the speakerphone. This is Dr. Patricia Martinez, Director of the Rhode Island State Board of Medical Licensure. This is Michael Johnson, Director of the CMS Office of Civil Rights. Judge Caprio addresses both officials. Director Martinez, Director Johnson, thank you for joining this urgent call. You are on speakerphone in Providence Municipal Court. Before me is an assault case involving Dr. Marcus Chen, a first-year resident at Providence Memorial Hospital, where his father, Dr. Robert Chen, serves as Chief of Medicine. Director Martinez responds immediately. Concern evident. Your Honor, we're listening. Directors, Dr. Marcus Chen forcibly removed a 64-year-old Medicaid patient from the emergency department, pushing her out the doors and causing her to fall and injure her hip. She was actively experiencing a heart attack. She later presented at another hospital, where she received emergency cardiac intervention. In this courtroom, Dr. Chen has made repeated statements. He claimed Medicaid patients waste hospital resources, are frequent abusers of emergency services, and do not deserve the same level of care as what he called real patients. He stated that people with private insurance contribute to society, while Medicaid patients do not. He further asserted that hospitals must prioritize revenue-generating patients and restrict care provided to Medicaid populations. Most concerning, he stated that his father, Dr. Robert Chen, Chief of Medicine at Providence Memorial, taught him to triage patients based on payment source, explaining that hospitals cannot survive if they treat every Medicaid patient like a paying customer. The silence that follows is complete. Director Martinez speaks first, her voice controlled but furious. Your Honor, Dr. Marcus Chen has just described patient abandonment, gross negligence, unlawful discrimination, and direct violations of EMTLA, the Emergency Medical Treatment and Labor Act. A physician may not refuse emergency care based on insurance status. These statements alone warrant immediate suspension of his medical license. Director Johnson follows, his tone firm. Your Honor, Dr. Chen has openly described systematic discrimination at a hospital receiving federal Medicare and Medicaid funding. Providence Memorial Hospital receives approximately $45 million annually in CMS reimbursements. If the hospital is deprioritizing Medicaid patients as described, we are initiating immediate suspension of all federal funding. Marcus attempts to speak. Your Honor, I was only explaining operational realities. Dr. Chen, you have confessed to patient abuse and discrimination. Be silent. Director Martinez continues. Your Honor, the Rhode Island State Board of Medical Licensure is issuing an emergency order suspending Dr. Marcus Chen's medical license pending full investigation. He physically harmed a patient, denied emergency medical care, and admitted to insurance-based discrimination. He is unfit to practice medicine. Director Johnson adds. CMS is also launching a full investigation into Providence Memorial Hospital. If these practices were taught by the Chief of Medicine, this constitutes institutional discrimination. Federal investigators are being dispatched today. All CMS funding is suspended effective immediately. Pending review, the call disconnects. Doctor. Robert Chen rises slowly, 30 years of medical leadership collapsing in real time. Your Honor, my son, he's destroyed everything. Providence Memorial employs 800 people. Without CMS funding, departments will close. Staff will be laid off. I made mistakes. I complained at home about reimbursement rates, but I never instructed him to harm patients. I never told him to discriminate. Exactly 60 seconds later, hospital administrators rush into the courtroom. They have been listening remotely. The hospital board chair steps forward. Doctor. Robert Chen, effective immediately, you are terminated as chief of medicine. The hospital board cannot retain leadership after your son publicly stated that you taught him to discriminate against Medicaid patients. Doctor. Marcus Chen is now crying. Dad, I'm sorry. I was just trying to explain. You destroyed my career. You admitted to patient abuse. You cost the hospital $45 million. Your license is suspended. Judge Caprio addresses Marcus directly. Doctor. Chen, your medical license is suspended. Your father has lost his position. Your hospital has lost federal funding. Now hear your sentence: assault and battery. Medical malpractice. 2 years in county jail. 5 years probation. A lifetime ban from practicing medicine in the state of Rhode Island. Full restitution to Ms. Dorothy Williams. Providence Memorial Hospital faces a $3 million federal fine. CMS funding will be reinstated only after comprehensive anti-discrimination compliance training is completed. Doctor. Robert Chen is forced into early retirement, his professional legacy in ruins. Doctor. Marcus Chen serves his sentence. His medical license is permanently revoked in multiple states. He will never practice medicine again. Years later, he meets Dorothy Williams through a restorative justice program. Miss Williams, I threw you out of the emergency room while you were having a heart attack because you had Medicaid. I called you a frequent flyer, a malingerer, a burden. I said people with your insurance don't contribute to society. I nearly killed you. I destroyed my father's career. I cost a hospital $45 million because I believed discriminating against poor patients was justified. Saying I'm sorry is not enough. For Dorothy takes his hand. Doctor. Chen, you believed your medical degree and your father's position made you superior to people like me. You believed Medicaid patients weren't worth your time. Now you can never practice medicine again. Maybe now you understand that everyone deserves care, not just those who can pay. If this story moved you, subscribe for more moments where Judge Frank Caprio proves that no medical degree places anyone above their oath. Remember the words that destroyed everything: Medicaid patients waste our resources. That is the legacy of Judge Frank Caprio. That is the courage of Dorothy Williams. Justice delivered, license revoked, discrimination ended.